Hey, good evening, everyone. We'll wait a minute because I know people are arriving from the waiting room, but we'll get started in just a sec. Well, good evening, everyone. I'm Chris Ames, president of Russell Sage College. It's my pleasure to welcome you this evening to this program sponsored by the Women's Institute. The Women's Institute is committed to advancing opportunities for women and gender equity and developing leaders for social change. Part of that commitment is a focus on creating constructive dialogue on contemporary issues, and this session exemplifies that approach. The global pandemic has called desperately needed attention to social and economic inequities, healthcare and outcomes, and wages and jobs, and access to the digital world, and childcare and elder care responsibilities, and prevention of domestic violence, and in public education. Tonight's program brings together experts in multiple fields to enhance our understanding of these critical issues and lay the groundwork for positive social change. For those of you who may be attending your first event sponsored by the Women's Institute, a special welcome and my hope that you'll be inspired to continue to participate, whether by a webinar like this or when circumstances allow, by visiting Russell Sage's campuses in Albany and in Troy. To present our program tonight, I'm happy to introduce the Executive Director of the Women's Institute, Shelley Calabrese. Thank you all for joining us tonight.
Thank you, Dr. Ames. Good evening, everyone. I'm Shelley Calabrese, Executive Director of the Women's Institute at Russell Sage College. Thank you for joining us for tonight's panel discussion, The Pandemic and Social Equity, a Multidisciplinary Perspective. The COVID-19 pandemic is a social and economic crisis just as much as it is a health crisis, with severe and far-reaching repercussions that are being felt across the world. From racial and ethnic disparities in our healthcare system to the absence of social safety nets, the greatest impact has fallen upon the most vulnerable populations with the least power. In tonight's discussion, we will hear from an expert on health disparities, a feminist economist who studies unpaid care, a specialist on domestic violence, and a superintendent from the New York City schools on equity issues in education raised by the pandemic. Our four guest panelists and our moderator are all highly distinguished in their fields. And since we have so much to discuss and in the interest of time, I'm going to give you just a brief overview of their backgrounds. Lorien Castell is the Director of Prevention at the New York State Coalition Against Domestic Violence and has worked to address intimate partner violence for over 2 decades. She specializes in community organizing and organizational development, as well as prevention strategies. Her planning efforts include creating trauma-conscious systems and environments that promote resiliency and healing, engaging men in the workplace, school and community settings to end gender-based violence, leadership development, nurturing youth activism, workplace violence prevention, and strategies that address the social and health inequities that increase vulnerability to gender-based violence. Dr. Mori Di Govaya is affectionately known, as I mentioned, as Dr. Mori. She's a leader with over 25 years of experience in the field of education. She's committed to transforming communities and redefining generational legacies via high-quality teaching and learning experiences in public schools. Throughout her career, she has led and supported schools as a teacher, principal, superintendent, policymaker, and currently as the Executive Superintendent of Queens South, with the firm belief that a child's zip code, origin, race, or class is not a predetermined hindrance to learning, but an opportunity for a new narrative that tells a story of success, achievement for all students who attend public school. And I'm also proud to share that Dr. Morey is an alumna of SAGE, and she received her EDD in Educational Leadership from SAGE College of Albany, and was also the recipient of the Outstanding Student in a Doctoral Program in 2017. Dr. Nancy Fulbree is Professor Emerita of Economics and Director of the Program on Gender and Care Work at the Political Economy Research Institute at the University of Massachusetts Amherst, and a Senior Fellow of the Levy Economics Institute at Bard College. Her research explores the interface between political economy and feminist theory, with a particular emphasis on the value of unpaid care work. In addition to the numerous articles published in academic journals, she is an accomplished author, with her latest book, The Rise and Decline of Patriarchal Systems, forthcoming. She has also written widely for popular audience, including contributions to New York Times economics blog, The Nation, and the American Prospect. Lynn Warner is a professor and dean in the School of Social Welfare at the University at Albany SUNY. Her research focuses on policy and system level interventions that could mitigate disparities in behavioral health services delivery, especially disparities experienced by groups on the basis of sex, immigration status, and race and/or ethnicity. Dr. Warner's research is interdisciplinary, and she has published widely in the areas of social work, psychiatry, and mental health and addiction services. Her research projects have been supported by national foundations, such as the American Foundation for Suicide Prevention, the Robert Wood Johnson Foundation, and by DHHS's Health Resources and Services Administration. Our moderator, the Honorable Dorsey Apliers, currently serves as Albany's Chief City Auditor. Prior to serving as Chief City Auditor, Dr. Apliers served on the Albany Common Council, representing the city's 1st Ward. She was elected in 2013 and re-elected in 2017. During her 2nd term, she served as a chair of the Public Safety Committee. Dr. Apliers is highly engaged with the Albany community, and she has served as Vice President for Community Health Initiatives with the Community Foundation for the Greater Capital Region, and as chair of Local Progress New York. She currently serves as a board member for Eleanor's Legacy, the Regional Food Bank of Northeastern New York, Center for Women in Government and Civil Society, the Capital District New Leaders Council, and the Community Foundation for the Greater Capital Region. Dr. Apliers is also a member of the Albany County Board of Health. Before I turn things over, I want to quickly mention that for the question and answer portion of the event, you will use the tab marked Q&A on your screen. Feel free to submit questions as you think of them, and we will get to as many as possible in the time allotted. Dr. Apliers, over to you.
Thank you so very much, Stacy, for this wonderful opportunity. It is truly a dynamic panel, and I look forward to the discussion that we intend to have. Anytime you mention women and social justice, equity, equality, you are speaking my language. And so I am in the right place with the right people. I want to thank you, Stacy. Thank you, President Ames, and the entire Russell Sage community for, again, affording me this opportunity. So to kick things off, we have an opening question that I will pose to our panelists. And each of our panelists will have roughly 15 minutes to respond to the opening question. After each panelist responds, we will then get into more questions, but also hear from you as our audience. And so I encourage you to start getting your questions ready, your comments ready, because we really want to hear from you this evening. So let's jump right in, shall we? So the first question to all of you is how is this crisis affecting delivery of social services, access to education, healthcare, etc. So as we talked about, this pandemic has impacted the mere fabric of our nation, the social fabric. And so we want to hear from you and your perspective. How is it affecting the delivery of the services that your work touches? So in particular, how are problems such as homelessness, poverty, or domestic abuse being exacerbated in this moment in time? And so with that, I am going to kick it to Dean Warner, if you can provide your remarks.
Thank you. Thank you very much for that introduction. Can everybody hear me?
Yes, we can.
Perfect.
Great, thank you. I am so honored to be here with this panel of women who I actually was expecting to go last and to be able to absorb all of your knowledge and insights as I framed my response. But I'm happy to take the first pass, and I'm actually going to change the question a little bit, or refocus the question a little bit, in that I'd like to focus on what I think has really been a relatively overlooked aspect of the pandemic, and namely that is mental health impacts. Compared at least to the popular press, even academic attention, we have heard a lot about obviously the health effects, the economic effects, and I think intertwined with those are mental health impacts. Common sense, social science theory, and existing data to date suggest that a stressful experience, such as this pandemic, will increase mental distress. It really is an open question if those impacts will be short-term or long-term, and if they will be greater for the groups that have been historically marginalized or equal. There really, though, is no precedent for understanding how a public health crisis of this magnitude will affect mental health in the long term. But given the unprecedented scale, the associated mortality, coupled with the increases in social isolation and disruptions to life, and those economic impacts, people have referred to this as a perfect storm. And all of the efforts to get us back to work, back to school, back to our social lives will be undermined if people's mental health is impaired. So this is an aspect of the pandemic that I suggest really must be brought into sharper relief as we grapple with the impacts of COVID and the attempt to move forward with the goal of social equity. And I was so thrilled to see the title of this panel highlighting social equity. And I'd like to share my screen, because no presentation is an academic presentation without a definition. So I want to share this definition. Hopefully, do you all see that? Not yet.
Not yet.
How about that?
Yes.
Great. So according to the World Health Organization, equity is the absence of avoidable or remediable differences among groups of people, whether those groups are defined socially, economically, demographically, or geographically. And for purposes of my discussion right now, I will suggest that mental health stressors are, to a large extent, avoidable and remediable. And so they are really, centrally important to this goal of equity. And I think maybe later in the talk, I'll come back to this second part of the World Health Organization definition, which is so important for someone such as myself, whose work is located in social work, that the efforts that we make toward equity, in order for them to be effective and sustainable, they have to go beyond attending to a particular health or mental health inequality, and they have to help empower the group in question through systemic changes, such as law reform or changes in economic or social relationships. And that's really such an important component of it as we think about what are the both social services and public policies moving forward that will help us attend to the pandemic with this equity lens. And just a little bit of orientation to the lenses that I bring to bear in the kind of information I'll be sharing is my background is really in a combination of social psychology and sociology. My doctorate is in sociology and social work. With that frame, stress and coping is a kind of just an overarching framework that really motivates a lot of understanding of social and individual, community level, and social problems, at stress at those levels, and then coping at the individual, community, and societal levels. And with this social work applied lens, the inquiry really is purpose-driven in that the interventions that we seek to understand and evaluate are those that will either minimize risk factors or promote resilience in the service of opportunities and outcomes for historically marginalized groups. So, it's been clear from the beginning of the epidemic in the United States that the impact of COVID has been greatest for those with the least resources and for those who have historically experienced disparities. And it increasing, from the beginning of the pandemic and increasingly, we've talked about sort of dual pandemics or even multiple pandemics. Some people are talking about it as syndemics because COVID has reinforced and reminded us of the very deep economic inequalities in the US. At this point in our history, we are also increasingly shown acts of racism and violence against people of color. We know that those acts of violence have always existed, but the increasing visibility of them is an important feature, I think, in the current pandemic context, and certainly important in terms of thinking about the mental health impacts. So those of you who maybe are sort of COVID news junkies, and I hope that for your own well-being, you kind of moderate your intake of the COVID news because it's fast and sometimes it's inconsistent. But when we think about the mental health impacts, I think it's important to recognize that we don't know a lot yet. And that as data become available, I just sort of offering a caution of it's data in real time, and I think we have to be sort of careful about what we assume about some conclusions of the data. And in particular, I don't know if you were aware of an article just came out in The Lancet about the long-term mental health consequences of people who've been infected with COVID. So not only are there sort of ancillary stresses associated with COVID, but there may be, at least according to this data, some direct mental health consequences. Then as we think about sort of the indirect effects of stressors associated with COVID, they range from fear of illness or death, grief, perhaps counterproductive coping by use of alcohol or substance use. There are also indirect effects because of deferred medical care or mental health care, people are making those decisions on a combination of maybe being fearful of exposure, maybe they don't have finances, maybe the healthcare isn't available, or maybe the healthcare that has been available is, because of the racist history of many mental health and health delivery systems, people are not inclined to use it. So combined with this huge disruption to our life as usual in terms of our social roles and the stressors that can be associated with that, and whether that's isolation from our social networks because we're isolated from colleagues at work, or extra burdensome roles because of parents having to work at home and having to take care of their children who are not in school. Really some quick data to just suggest that, again, common sense would dictate that this is has been a stressful time, and because of that, there is increased risk for mental health. So there's a range of kind of population-based studies that have shown the relative risk for mood, anxiety, and substance disorder are higher for patients who have COVID-19 versus other kinds of infections. The serious psychological distress among adults in the US has been reported to be higher in this COVID period than in prior periods. And so, for example, the anxiety symptoms and prevalence of depression symptoms have been about 3 to 4 times higher in this COVID period than in prior times. And then even more severe indicators, we've seen emergency department visit rates higher for all sorts of mental health conditions, suicide attempts and overdoses, again, currently compared to prior times. I think a couple of caveats as we think about, as we talk about mental health in general, we need to remember that there's a continuum from symptoms that are short-term, for example, sadness due to significant loss, to diagnoses like depression with multiple symptoms that occur over a period of weeks. And we're trying to understand if a catastrophe like COVID is a risk for people with a history of mental health conditions, or if it is a risk for incidence of new onsets of mental health problems among people who didn't have them before. And so that's something that we as a society I think will have to keep track of and try to tease out. Some other caveats of the data that are available that are really important are, as you see in these bulleted items here, the population surveys don't always report findings by race, ethnicity, or income. And this is a real limitation because of what we know of the disadvantages in those populations. It could be that their maybe future analyses will report by race, ethnicity, or maybe the data haven't been reported so that they can do that, but that's a really important question in terms of, as we try to think of what might be the interventions, we will need to know in particular communities for particular groups, what does it look like, and make sure we have the right data. To the extent that there is information, I was just able to find a couple of studies that show both differential impacts that disproportionately affect minority populations, in the example of Maryland, with Black residents having higher rates of suicide than white residents. But in other studies, Asian Americans, Hispanics, and Latinx respondents not having as high reports of anxiety. So to me, this communicates, again, a sense of, we know that there will be mental health implications, but we need to be very careful to not assume that general population trends are going to apply equally, depending on the community that we might be most interested in. As I mentioned, we don't really know what to expect for longer term mental health impacts, but I just want to point out some of the some likely conditions that suggest that the mental health impacts not only will be longer, but will disproportionately be experienced by some groups compared to others. And this very interesting concept of COVID-19 bereavement burden, which suggests that given the scale of COVID-19 mortality, that people are losing close kin at unprecedented rates. And we know that those are not only social losses, but those are economic losses as well. When families lose wage earners, when families lose providers, that has an economic impact. Given that we know there's a disproportionate mortality for Black Americans versus white Americans, it's probably not surprising to see that this bereavement burden is higher for Black Americans compared to white Americans. And so that, again, is a sort of a bellwether, I think, for us to continue to pay attention to that. I won't go into a lot of detail about the kind of the stressors related to the economic impacts of COVID on short and long-term mental health impacts, other than to remind us that we know that unemployment and inadequate finances are stressors. And there's data to back that up. The question will be, for people who are having temporary economic and financial setbacks versus longer term financial setbacks, and how does that overlay with their individual recovery and actually with our societal recovery.
And Dean Warner, I just wanted to give you the heads up that we have time for probably one, no more than two slides.
Great, I'm almost done. So the last piece that I think is really important to factor into this complexity of trying to understand what the mental health impacts of this current COVID crisis are do relate to this really important component of racism and racist violence and the mental health impacts associated with those. This slide really just outlines pulling from various studies that the experiences of racial discrimination have been shown to be associated with reduced life satisfaction and self-esteem, increased symptoms of anxiety and depression, and suicidal ideation. There were some studies done right after 9/11 that showed discrimination specifically that was elicited because of 9/11 was associated with greater psychological distress. This was particularly true for Arab Americans and worse health. Internalized racism, people who have kind of accepted negative attitudes or stereotypes held about a minority group, held by the majority group, magnify the distress experience and that's associated with discrimination and is itself associated with poorer mental health. And then, people who are targets of discrimination may not seek health or other services. And because of that, then that will then reinforce any stressors and symptoms they may be experiencing. Continuous media coverage, both of the pandemic and racist violence, may intensify anxiety and fear. But then, a protective factor has been shown that strong ethnic identification moderates the impact of racial microaggressions and reduces depressive symptoms, and so may serve as a protective factor. So all of this complexity, I think, really reinforces for me the importance of acknowledging the interrelatedness of our health, mental health, economics, social support, and what are the both kind of individual actions that people can take to advance their own health and mental health. But more importantly, I'm so looking forward to hearing from the rest of the panelists and the audience about what are the community and policy level interventions that will attend to these concerns in a way that will not reinforce these these disparities, but can do them in a way that will holistically propel our society forward.
Dean Warner, thank you so very much. That was a packed presentation, and I feel that it helped level set us in a way because it touched on so many different issues, as you pointed out: mental health, economics, social support. You also, I think, highlighted often what we overlook, because oftentimes people suffer with mental health issues in silence, whether that may be some of us participating tonight, family members, our neighbors. It's such an issue that impacts us all, but oftentimes gets overlooked. And then also the importance of highlighting stress and stress coping, and in particular among communities of color, as you mentioned, who have been disproportionately impacted by the pandemic. There's so many different, there's a pandemic, epidemic, so many different factors going on at one time. And so we're talking about compounded stress on top of stressors that have already existed due to racism and all of those isms that we often talk about. So thank you for centering us in level setting. So what I would like to do is pivot to you, Dr. Digovaya, to talk about this pandemic in the context of our educational system and how it's from a systems perspective, but also I'm sure you're seeing how it's impacting students and families at a very individual level. So if you can talk about that and how this pandemic has exacerbated some of the issues associated with education, that would be great. And then of course, this is a free-flowing discussion. So if there are other areas of interest that you want to highlight, please feel free to do so.
Thank you so much, Dr. Page. Thank you so much.
You're welcome.
Thanks. Okay, so I wanted to, I realize I can't share in the chat, but I wanted to just bring to everyone's attention, in August, I transitioned to the role I'm currently in as Executive Superintendent in Queens South. And what was on my heart and on my mind was the work of the principal. I haven't been a principal in over 10 years, but I recognize that if there was a group, a community that was holding the hope in their hands of what was possible in this season, it was a school leader, it was the principal. And I wrote an article, which I'll gladly share with Executive Director Calabrese, and you can put it to the community, on the 7 pathways of leadership in a crisis. So what I want to invite everybody to do first thing is put your hand, or put your right hand on your heart and your left hand on your belly. And I want you to take the deepest breath you possibly could through your nose, keeping your mouth closed. You should feel your belly expand. Eventually your diaphragm begins to expand, your chest should rise, and take it in, chin up a little bit, hold it, and exhale it out. Do that 2 more times. Take a nice deep breath in, feeling the expansion of your belly filling with the air, diaphragm expanding, chest rising, chin up a little bit, hold it, and exhale it out. 1 more time, deep breath in, filling your body with air, hold it, and exhale out. That is how I, as a leader, have been getting through this year. I am an educator, I'm a mom, but I'm also a yoga and mindfulness instructor. And I want to start with the idea that school systems get to figure out what are the things that the leaders, the teachers, the families need in order to leverage through a crisis. Dean Warner shared the brutal truths, which is a part of the 7 pathways, which is to face the brutal truth that mental wellness, the economic condition, the social issues around racism in our country that were already present have only been exacerbated by the pandemic. Our school system, 2 years before the pandemic hit, decided that social emotional learning was of utmost importance. So one of the things they put into place was to have a yoga and mindfulness in school. So we had the yoga and mindfulness teacher preparation program. And then honestly, initially we began it out of economics because we figured it would be cheaper to have our teachers trained by our teachers than to continuously keep on paying vendors from the outside. Little did we know that when the first graduating cohort, which I was a part of, which is where I got my certification through, would finish last January 2020. And then by the beginning of March, we would find ourselves closed in the pandemic. And I start with this story because it's really important to know what works in a season when you're in a crisis. The overburdensome ideas of mental wellness, disenfranchisement in communities that are already disenfranchised, being more disenfranchised because of the pandemic, the tech issue, which I'll talk about, the tech divide, building trust when we're separated, when it's hard having trust when we're together, and understanding the role of the principal and the leadership that goes along with it to actually help them navigate through this crisis, required that the leaders themselves be socially and emotionally well. So the first thing I just want to offer is that space, considering what is it within your respective school systems that is needed and wanted so that healing can take place to actually be able to navigate. Within the article, The 7 Pathways, I talk about the idea that leaders begin with gratitude, knowing how to reach out and connect to and thank their constituents, their communities, and so forth. See, what was happening within New York City, and I'm sure in the world, was that one, New York City was committed to making sure that as many of our children were able to be serviced, whether they were being serviced at home. At one point, we were completely closed down as a city, but then as the fall came and the new school year came, we had a blended model where some children and families opted in to be in person and some children opted in to be remote. What that required was understanding that there would be staff who make the same choices. There'll be staff who'll say, you know what, medically, I'm not able to, so I'm going to be home, or I am able to come in. So the acts of gratitude and really being present within that gratitude, because the principals were also in the same position. They were the ones deciding, am I working remotely or am I working in person? And gratitude is actually one of those strategies, sort of like deep breathing that I started with, that is often overlooked. Gratitude has been proven to improve sleep, improve wellness, improve communication, improve relationships. So having leaders who understand where their thank you lies, and the thank you beginning with themselves for showing up in this space, because all too often what I found happened throughout this time period is that people often thought from a deficit model, which was such an easy thing to do because so much has been lost during this season. People lost family members, people lost friends, people lost a way of life. And if that is you and you're watching this, my condolences and much love and healing to you on your losses. And at the same token, we saw that there were children and families and school system as a whole that were coming together in powerful ways. So places where there was food insecurity, community played a big role in making sure that everybody was able to eat. In places where there was tech issues, we've gotten grants, we've reached out to people. The Department of Education is on a mission to make sure that every child has a device. Many children have received their devices. At this point, we're really replacing devices that have been broken or lost, but that was a real problem at one point because we wanted to make sure that our children were being educated. And in places where I know I am currently right now in Queens, like places like Far Rockaway, South Jamaica, Queens, these places not only had students who were challenged with having technology, they were also challenged by being a Wi-Fi desert. So if I have the technology, where am I getting access to the Wi-Fi? So adjustments that the DOE had to make was initially the iPads that came out, you would have to have your own Wi-Fi. Eventually, these are the iPads that we've been giving out on the latter part of the pandemic experience have had VPN. Again, these are things that were, you would not necessarily think about as, like could be a compromising factor, but it really was. And it also was, it was one of the wins, I think, of this time period, because now there's no backsies on this, right? All of our children have had an opportunity to experience technology. And even sometimes due to staffing limitations, our children would go in and still have to use technology. So it took a pandemic to break that inequity. And we're still working on it because all communities have not been completely healed of that issue yet. So we're still working on it. But it took that, I look at that as one of the wins of COVID, is that it took a pandemic to make sure that all children would have access to technology and 21st century learning through digital curriculum, which was not happening before. The other thing that, and this connects back to the breadth that we began with, that I pushed principals to think about within the article, was about being a stand for their own wellness. And our school system has become very sensitive to the yoga and the mindfulness work to make sure that families, teachers, leaders are well. We've all heard the African proverb, it takes a village to raise a child. Who's in the village? The village gets to be well. And this taps into Dean Warner's presentation on mental wellness and using strategies such as yoga, such as mindfulness, such as restorative circles, which are technically for, usually used to reduce suspensions, but those conversations and that narrative help create wellness within communities. How are you doing, right? Connecting with people and being in communication is another pathway that I'm actually able to see you within your current state, if it's a state of pain, if it's a state of anguish, if it's a state of disconnection, encouraging our children to do everything from come on screen and be seen so we know that you're well. Things such as reforming how we do attendance and making sure that, because we lost a lot of children during this time to either, they left New York City because it was a very difficult place to be at one point. We were at the epicenter of the pandemic, and I know many families left because of it. So attendance, I have a whole new review of what attendance looked like. We used to have the blue emergency cards where families would fill that out, who has access to the child, who doesn't have access to the child. I'm talking about my attendance people now about, we have to get neighbors' addresses and numbers, and like who lives next door to you, so we could keep track of you and make sure that you're safe. Because in this season, when people moved and we didn't know where they moved to, and honestly, who was really being connected at one point at the highest part of the pandemic in New York, it was hard to find certain children. And it was scary at times. So it was also an opportunity to revise how we do systems, structures, and protocols around things like attendance and student safety. And another pathway I want to share with you is around choosing narratives that serve, right? Like, where are we in the story that we're telling? And this goes back to, are you speaking within the affirmative or are you speaking within the deficit model? There are a lot of things that have happened during the pandemic that were tragic, and there's no doubt about that. But we also get to figure out how we could turn that tragedy into the story that we want to live past. Schools are in the process right now in New York City, elementary, middle, and high schools are open. Now, the goal is to get all of our children back. And within that space, we've been talking about ways in which we can help build trust within the community so that parents know that within the 6-foot rule, when our children are coming back for social distancing, with the CDC saying, 3 feet, we're going to figure out what it looks like to make sure that your child is safe. So what does it look like to assume that the school system actually has the best interest at heart? And that requires building trust, and that requires conversation. So there has to be a great deal of sensitivity to what people have gone through, what they have had to navigate through, what they've lost, and even in some cases, what they've gained. Because we've learned that there are children who have thrived. Children who were not thriving physically in the classroom are thriving remotely from home. And then there are other children who are seriously calling forth for their opportunity to go back into the school, right? But we want to make sure that everyone is safe. So we've orchestrated, we have an idea around what we're calling the homecoming. And that's looking like people returning back to the office, getting time to assimilate back into the school community and making sure that they are well, right? Because it can be very jarring after not being in a space for over a year to now come back to it. And also in a season where an illness, where close proximity raised so many alarms, right? I'm sure We've all had the situation where somebody may have coughed or sneezed around you in this time, and it's like you immediately assume the worst. So this is why the assuming best intentions and assuming the best possible narrative is actually a win for principals and school leaders as they're thinking about how they navigate through this time, right? And the flexibility that's also required, because while I mentioned earlier that all schools are open, we're still in the middle of this pandemic. So what we have had to face, and this is where the building trust piece comes in with our communities, is there's this opening and closing if there's a certain amount of cases. So if there's a case, if there's a certain amount of cases found, if there is exposure, somebody's been exposed, that has implications for what happens in the school community. So letting parents know how to get childcare, who they can tap into to get that resource, and make sure that they are creating some degree of stability and consistency, because those are also the pieces that, when they are not there, builds this fragile state for our children and for the school communities too. Because as I mentioned before, the village has to be well the village has to be well as well, right? Teachers, leaders, they're all facing the same crisis, which is what makes it so difficult. But it's in the mindset shift and how leaders are putting forth the work and the bringing together of community towards building trust that actually makes the difference. Another pathway is around balancing change and urgency with flexibility, compassion, and grace. I don't think I have ever used the word grace more than this year. This year, grace was my word. People said, I'm sorry if their child ran behind them in the middle of a meeting. It's life. It's life. And I've actually come to appreciate the dog barking. I've come to appreciate, the child interrupting, because it has really just shown us how our worlds have bridged between work and home. And for the teachers who've had to teach from home with their own children learning at a table not too far away from them, or the parents who chose to put their children back in because they had to physically go back to work. These are the spaces where the change and the urgency get to be balanced out with greater flexibility, greater compassion, and greater grace, right? Because it's been such a human experience that we've had to endure. And our schools are living organizations. I always say schools are organisms. They're not organizations necessarily. It's a human place. So leadership that is anchored in the idea that urgency and change get to be balanced in the space of a compassionate heart, in the space of a compassionate system, knowing that you might be in a Wi-Fi desert type of community. So if a child has not logged on, don't assume that they're not interested in being in school and that their attendance is poor. Make the assumption that maybe something happened with the Wi-Fi, right? It's like those are the places, we had grab and go lunches at one point, and we pushed and we pushed and we pushed to ensure that hot food would be available, because to the food insecurity that this pandemic grows up. So I hear you tapping into me. So I'm going to just say this last thing, which is that schools are the hope. Schools are the hope. So we get to teach, we get to embrace, and we get to train our children up, train our leadership up, our pedagogues up in a space that to solve for what is wanted and needed. And what was wanted and needed during this time was social emotional supports, practicalities around Maslow's tier 1, safety, security. So that looks like I have what I need to be able to learn technology. I have food, right? We have grab and go lunches. Now we have hot lunches, right? I have shelter. I'm safe. And in bridging of those pieces together, we get to be the possibility, which is the last pathway. I encourage every leader that I work with, I encourage myself on every morning, be the possibility. If there is something that is going on that is awry, I'm confident that the school system actually has the design capability and the talent to actually disrupt whatever COVID-19 attempted to take away. Thank you so much.
And thank you so much. And I'm sure your school district is so blessed to have you. And I think that this was a perfect segue from Dean Warner's presentation on mental health, because you talked about some very tangible tools and interventions that you and your colleagues are incorporating to make sure that while people are dealing with all of the other aspects of the pandemic, it is allowing them to have a reprieve by participating in yoga and deep breathing and showing grace and being empathetic and checking on people. Those are the types of things that help to improve mental health outcomes. And so thank you. I look forward to hearing more about the work that you're doing in the midst of our Q&A. So economics came up quite a bit. So with that, I would like to transition to you, Dr. Faulbray. I've never met a feminist economist. And so this is a treat for me. I'm going to, the floor is yours to provide some remarks.
Thank you so much. I really enjoyed all of the presentations. I guess I am your representative of the dismal science here, but I actually have a somewhat upbeat message, I hope. I look at the pandemic from the perspective of trying to understand social division and also trying to influence economic policy. And as Lorien pointed out, we had a lot of inequalities, a lot of economic and social inequalities in our society before the pandemic hit, and the pandemic really dramatized those and amplified those. And I think the interesting paradox of the pandemic is that it had both a very divisive effect and a very unifying effect, somewhat in tension with one another. So first, about the divisive impact, you know, the health implications of COVID-19 were very divisive, are very divisive. We know that mortality has been almost twice as high among Black, Hispanic, and Native American people as among whites. We know that elderly people have been much more influenced, much more susceptible than young people. Men somewhat more susceptible than women. Elderly women in nursing homes, however, generally a largely indigent population, and the people taking care of them, primarily workers of color, very vulnerable to infection. But on the other hand, we also know that infection itself really highlighted our mutual dependence and the need for reciprocity and social responsibility. We had large groups of people defying that concept, but we also had very, very large numbers of people taking very seriously their responsibility for the health of other people. So the economic impact of the pandemic was also very, very disparate, very unequal. The stock market boomed, and the stock market is still booming. People at the top, professionals and managers able to work from home, have not been very adversely affected. Unemployment has been greatest among service workers, pretty much low-wage jobs, those who couldn't work effectively from home. Black and Hispanic workers very much overrepresented among, within that population. Essential workers still able to work, but facing really enormous health risks at work. In fact, the overrepresentation of people of color in quote unquote essential jobs probably helps explain their greater vulnerability to infection as well as mortality. Women were affected, but mothers in particular were forced out of the labor force because of the responsibilities of family care. And that remains the case. And last fall, about 40% of mothers who were unemployed stated that it was due to lack of childcare. So it was very much the shock to the childcare and educational systems at play on that. But those disparate economic impacts, not just limited to paid work, also really evident in unpaid work, which is an area that I've studied for a long time and am particularly interested in. So we know from surveys of time use as well as just personal experience and common sense, that the unpaid workload of women in particular went way up during the pandemic, and that was especially true for those caring for children. Men's unpaid work also went up by a not insignificant amount, and I think there was a sense of the necessity for more cooperation between men and women and fathers and mothers to basically get through the pandemic. But the proportionate shares of contribution to unpaid work between men and women remained about the same. So, you know, less gender inequality in some respects, but unchanged in other respects. I think learning, as an economist, I think of learning as a sort of form of unpaid work that's really important to future outcomes for kids. And we saw huge disparities there with that have already been mentioned about, you know, access to broadband and assistance with homework and so forth and so on. But let me point out that the response to the pandemic was shaped in some ways by some increased solidarity that is represented really by the stimulus program in the spring. I mean, it's pretty unprecedented in American social policy to send out checks of assistance to such a wide swath of the population, a wide enough swath that the kind of stigma of means-tested assistance was overcome. And pretty much everybody except people at pretty close to the top of the income distribution benefited from those stimulus checks. So it's kind of an amazing, pretty historic and initially very bipartisan commitment to cash assistance. And I don't want to overstate the benefits of cash assistance. I think there were so many other impacts that are not captured by, or, you know, even affected by, or even mitigated by cash assistance. But it's still fairly amazing that poverty rates defined in terms of income did not increase initially during the pandemic because of the massive level of aid, the expansion of unemployment insurance, the assistance to small businesses, the just a variety of important, you know, really important programs. But more important even than that is the initiative that the Biden administration has put together going forward to try to actually increase investment in care infrastructure in ways that will benefit low-income families and low-income women in particular, but also do that in a kind of universalizing way that promises, I think, more political resilience and more political consistency. So let me just go over some of the really important provisions of the American Rescue Plan. In addition to the stimulus checks, which I've already mentioned, you know, this plan is allocating $400 billion for home and community-based care for elderly people. This is a huge improvement in the use of Medicaid funds. I mean, expansion and improvement. You know, in the past, most Medicaid funds have been going to nursing homes, varies by state, but a lot of them to nursing homes. People have a clear preference for home and community-based care where people can stay in their own homes and have someone come in and help them, and also provide, in many instances, to provide pay for family members who are providing that care. So it kind of crosses the divide between paid and unpaid care by allowing partial payment for family responsibilities that have previously been, completely unpaid. Bigger subsidies to childcare and support for the childcare industry. But the really big thing is a huge expansion in the child tax credit. So this child tax credit under the American Rescue Plan, which has been passed, so this is going into effect, right? This has increased the child tax credit from $2,000 per child that was limited mostly to families in the upper half of the income distribution because it wasn't allowed, it couldn't be realized unless you were paying income taxes sufficient to offset. Now it's extended eligibility to low income families. It's eligible to almost all families except those at the very top. It's a lot of money, $3,600 per child under 6. It really represents a kind of family allowance like European countries have been using, have been applying for years and years and years. So this is a huge step forward in public policy, but it's only in place for a year. So without enough political awareness and support of this program, we will lose it. And, whatever the limitations of cash assistance, it is a very important means for families to meet their basic needs. The American Jobs Plan that's on the board now, it's not clear that it's going to pass or not. But if it does pass, it will provide, it will not just increase existing childcare centers, it will actually increase the supply of childcare by creating new childcare facilities. And again, it's path-breaking in its emphasis on quote unquote investment in care infrastructure, saying that, look, this is like investing in broadband and bridges and roads, that investing in care and family care for children, the disabled and the elderly is part of what we need to make our economy run efficiently and fairly. Both of these programs, both of these the rescue plan that's passed and the jobs plan that's still in contention, have a lot of discretionary funds going to states and local communities. So we really need to work on the state level and local level to make these programs a success and make them visible and really show people what they are, because I think that they really are an expression of a form of solidarity that has emerged from the pandemic. And it's hard. I just know from experience, it's really hard to understand all these programs. What is the child tax credit? What does it mean? Why are we getting it? Who's paying for it, et cetera? There's not enough effort, I think, to kind of improve people's economic literacy in ways that enhance their understanding of what this really means as a recognition of the value of unpaid work and care. So I hope we can all get behind these programs and have a really positive agenda moving forward. Thanks.
And thank you so much, Dr. Fulbright. I appreciated your presentation, and in particular as a working mom who has been home with my 2-year-old, making the decision to keep her home. And my husband works mostly in the office. And so it is a huge balancing act, working and taking care of a child or a parent. And so the acknowledgement of that in our national policies, I think is huge. And I agree with you. We need to all get behind those endeavors so that we can ensure that they are sustained. Again, your presentation packed with so much great information and providing a high level overview of the American Rescue Plan and the Jobs Plan. It is a lot for the average person to digest, and I appreciate you dropping some tidbits during this panel discussion. So with that, we'll transition to Lorien to talk about the pandemic in the context of domestic abuse, which is your area of expertise. So would love to hear more about how the pandemic has exacerbated the issue of domestic abuse. And I'll turn the floor over to you.
Thank you so much. Well, good evening, everyone. I'm so pleased to be here with all of you. And I just want to thank Russell Sage College and the Women's Institute for the invitation to join this important conversation. I'm really happy to be able to contribute to it and to be among such distinguished panelists. I think it might be kismet that I'm going last, because victims of domestic violence, really, just in terms of what we do to prevent domestic violence, the strategies that we employ, and the interventions that we utilize to wrap victims of domestic violence in services, run the gamut of mental health supports and emotional well-being supports, and also educational support. So I was really interested in hearing about that. And of course, we've been rallying throughout the pandemic to make sure that young people who were in emergency shelters had access to what they needed in order to stay in school, whether it was remotely or hybrid or whatever. And of course, victims of domestic violence are often very economically disadvantaged due to the abuse that they're experiencing. So I want to share just a little bit about, the overarching question posed to us was such a good one. And of course, in my role in the domestic violence community in New York and across the country, I've been very interested in addressing and very concerned about what has been happening for victims of domestic violence. I want to stop for a minute and just share with you a definition. Dean Warner, thank you for saying, no presentation, particularly from somebody from a public health background, is complete without a definition. Just to sort of share with you and paint a picture of the landscape, domestic violence is a pattern of coercive behaviors and tactics that one intimate partner uses with another partner to establish and maintain power and control. It can be physical, but not always. And it can be economic abuse. It can be sexual abuse, which also includes reproductive and sexual coercion. It can be emotional abuse, and it can be stalking. And so much of stalking behaviors right now include technology. Particularly currently during the pandemic. And so that's really what we're talking about. But the New York State Coalition Against Domestic Violence and every state in the country has a coalition like mine. We believe that domestic violence is a human rights issue. We believe that it is caused and exacerbated by the inequities that we're talking about tonight, social inequities like gender inequity, racial inequity, and of course, we work to address poverty. We're working to address poverty and housing insecurity and food insecurity all of the time. So I want to share with you a little bit about what domestic violence looked like pre-pandemic and what we know from studies and from some scans that we've done here in New York and across the country about what has been happening since the pandemic started and currently. So before pandemic, the Center for Disease Control and Prevention, which is the gold standard for research in this area, they conducted a groundbreaking study about a decade or so ago. And not surprisingly, it bore out most of the previous research that we'd done in this area. But it did illuminate some nuances, which was that the context and the consequences of domestic violence really mattered. But the numbers are same as it ever was. Globally, the magnitude and the prevalence of domestic violence is 1 in 3, and that's from the World Health Organization. Here in the US, people believe that the number is more like 1 in 4. 1 in 4 women will be abused in their lifetime, which is quite daunting. And some of us would say 1 is too many, but 1 in 4 means that if there are 100 people attending this panel discussion, 25 of you are either currently being abused or have been abused in your lifetime, right? And so that's a big number. And I want to share with you a little bit about what we believe. It's so underreported normally, but we certainly know that during pandemic, it went underreported because of the lack of privacy and confidentiality that a survivor isolated with their perpetrator might have felt. They would have been prevented from reaching out for services. So I just want to tell you again, pre-pandemically, in just one day in 2016, 41,000 adults and children fleeing domestic violence found refuge in an emergency shelter or in transitional housing. We do a nationwide census once a year. In New York, where many of us are residing, I want to say that New York has the highest number for services provided and the highest number of unmet requests in the country. The highest number of services provided and the highest number of services that are unmet. And our census is sort of in comparison to what's happening in other states. So on that one day, 4,000 victims of domestic violence were served and found refuge in emergency shelter on one day, just this past year in 2020. But 4,300 access services that were not, that did not require emergency shelter, but required things like legal advocacy, housing, and a slew of other services, support groups, child support groups, those kinds of things. And 2,000 hotline calls were answered in that same day, just right here in New York. So 2,000 unmet requests, 80% of them were around housing. So you probably are aware that we have a housing crisis in the country, and particularly here in New York State. Imagine what the pandemic has done to exacerbate the housing shortage. If you're in a state like New York, where there's a moratorium on evictions, if you're complying with CDC guidelines and you're providing emergency shelter to survivors, let's say that we have 30 beds, you can't fill all 30 beds unless you're in an apartment setting, which is rare and is normally in urban settings, like in New York City, in Syracuse, in Rochester, there might be units, but in congregate care settings, which is the model we've been using for decades, very problematic in and of itself, you can imagine that people were turned away who required shelter. So if you can think of all of the services that someone who is victimized by their partner needs to access, you can then imagine how hard it is to navigate those resources during normal times. During a pandemic, when many services have been shut down, it's almost impossible. And so we're talking about healthcare practitioners, we're talking about clinics and hospitals, we're talking about shelters for sure, we're talking about mental health services, substance use services. And let's just take housing, for example, with the 80% of services requested in one day, access to affordable and safe housing has become a crisis. With domestic violence, being in the business of providing emergency shelter, not being able to do that, having to turn people away during the pandemic, means that we don't know how many people actually needed that. And it may be a very long time before we're even really fully aware of the consequences and the impact of the pandemic on folks who needed services and either sought them and were turned away or didn't seek services at all. I want to just paint the picture of the housing. Among mothers with children experiencing homelessness, more than 80% had previously experienced domestic violence. 38% of all domestic violence victims become homeless at some point in their lives. So homelessness and domestic violence are absolutely connected. There's a great nexus between that. We know that domestic violence is the leading cause of homelessness for women and children in our generation. So, that is something that I really wanted to share with you. Now, not all is lost. But again, when you think about the other things that may seem obvious to the general public that victims of domestic violence need to access, think about the courts. So courts were not operating for a very long time. And so proceedings that needed to be before them that would have put in legal remedies that might have increased safety for a survivor and their children were put off. And so when I think about what will happen next, that backlog of those cases as they come up and as they are heard and hopefully they will be heard, is going to be one of those things that we face for sure. Much of our advocacy during this time, and I don't want to take up too much time because I see our time coming to a close together. Much of our advocacy for the past year was really, honestly, just to ensure that survivors who might need services understood that domestic violence programs were still open, that were still open for business, and that they were able to respond, even if they were responding through a sort of a telehealth model, even if they were responding over the phone and not in person. We also engaged in essential businesses that we had never engaged in before, the most innovative of which is launching a pharmacy initiative, knowing that with only essential businesses open, that survivors might be isolated, but that they might be allowed to go get groceries and pick up medications. And so we worked with the 2 agencies that are statewide that support pharmacies and pharmacies that stand alone, but also pharmacies that are part of a grocery store, retail store. And we worked with them to create some information that every single person who came to pick up medication would be notified that there were supports out there for them. And so that it wasn't only domestic violence related, so that if they went home to the person who was abusing them, there'd be this information about domestic violence. We made it very broad, that there's mental health services, there's support around medications, we sort of ran the gamut, and then domestic violence was in there. And there were posters and flyers and things that could go in the pharmacy bag so that people could bring that information home with them. The
Lorien,
other thing, please.
we're close to time, so if you can
Yes.
round out your
Very
remarks.
quickly. We do also, so I want to say that we did rally. I was very interested in hearing about the efforts of the educational system. We did rally to make sure that even though students who had to be remote or hybrid, who may have had devices or may not, but if they had devices and they were in emergency shelter or in transitional housing, that they had access to Wi-Fi. So I wanted to reinforce that, that was something that we recognized very early on when students were going back to school in September. I do want to say that the federal government has committed some money to provide some relief to victims of domestic violence that New York has put in their state budget. That will help domestic violence survivors independent of services, social services or domestic violence services, but they're also supporting the very important services that shelter programs and domestic violence programs provide. And then the last thing that I just want to say is I have been involved in a project that I'm very proud of, which is trains domestic violence programs and emergency frontline workers on the nexus between domestic violence and disaster, and how victims of domestic violence are disproportionately affected by disasters like hurricanes and earthquakes and floods, that communities of color are disproportionately affected by disaster. And I want to say that as much as we are proud of that project, we were woefully underprepared for pandemic. And so that's one of the things that we're working on. It's really important to make sure that, we have filled in the gaps of whatever services that were provided across the state and across the country to make sure that people are continue to have this consistency of appropriate services. So thank you so much.
Thank you so very much for your insightful remarks. We have some time for questions from our audience, and we have one question in the chat. And so what I would encourage, if you're tuned in and you have a question or comment, please feel free to drop it in the chat. Our beautiful panelists are popping back up on the screen here so that all of them are available to answer any questions you may have. So our first question starts with a comment from Patricia. Thank you all for sharing the facts and figures and raising our awareness. What can tonight's participants do to help address these significant issues? And if I could have two of you respond to that, that would be great. Would anyone care to take that question?
Sure, I'll start. So I would definitely say, thank you. So this was fantastic, by the way. Thank you so much, Shelley and President Ames. This was fantastic. I would say, as a school person, I would say occupy schools, right? Think about ways in which you can be in contribution to what's wanted and needed. What's wanted and needed, our parents are in need of support, figuring out ways in which we can reopen schools safely, to ensure that our children, when they get into the space, that they're safe. So there's the logistical stuff that the department can take care of, but then there's the community things to bring us back. So, we started doing virtual town hall meetings, and we have a lot of resources in the community, and whatever skills and talents that you could possibly bring that's going to expand children, it's going to bring them together, it's going to expand families and help bring them together, not only amongst themselves within their own internal unit, but then thinking about what that looks like for them in the school community. We definitely need a bridge from this time back to, and I want to say back to the normalcy of before, because there's no backsies here, but this creation of what's possible in the new, right? What does school look like in fall 2021, 2022 that wasn't present before? So really, if you're in the community, figuring out ways in which you can be a contributor to the space of a school and really lift up the community with what hasn't been done, what's not present, and what's not available through your talents. That's what I would offer.
Thank you for that. Anyone else? All right, so we do have a question that I would like to throw out to the group. In what ways can the recognition of social inequities from the pandemic serve as a roadmap for social change? And I know many of you touched on that, but if you could spend a few seconds just making it very explicit and plain. And feel free to chime in if you have a response. Let me read that again. In what ways can the recognition of social inequities from the pandemic serve as a roadmap for social change? And I'll kind of kick it off with the comment that you made, Dr. Mari, when you talked about the fact that we knew that there was a technology divide pre-pandemic. And this has forced us to work towards closing that divide because the school systems and educational systems had to be responsible for making sure students had what they needed to learn. Not just the computer, but then also the internet access. And so that's one example. Are there others?
Absolutely. Well, I can, to that end, again, I really think, and this is me, Scott, a glass half full, I really do think the pandemic has given us a window into the direction we get to go. So even like the racial inequities that we saw play out with George Floyd, and even recently again in Minneapolis, it happened again on Monday. I know the school system is beginning to look at what does it look like to construct. Today I did a training with my team on being an anti-racist school leader. So it's opening the door, and like through what we're seeing as gaps, I know the school system is saying, oh, that's a gap, here's how it's showing up. So within the tech divide, the communities hardest hit by the tech divide were the communities hardest hit by COVID, right? Which were predominantly communities of color. And what does that look like now when you're thinking about creating a school system that would be focused on anti-racism, where there is an activism and there's an understanding that we have facilitated certain systems and structures, i.e. only certain children have access to broadband and technology and digital curriculum, that it took a pandemic for us to now say, hey, let's give this, let's make sure that that's not the case and that every child has access to it. So I think that, there are ways in which, even like it used to be order precedes learning. Now it's social emotional supports precede learning. Who are you? Where are you in the space? How are you feeling today? Is any, like doing that empathy interview, doing that check for the child when they're coming in, or even the family when they're coming in, right? They're not making the assumption that, oh, you're just disconnected or you're off screen because you don't care. No, maybe you're off screen because you have to be in the bathroom right now because your two other siblings are monopolizing the living room and there isn't space in there and mom is in the dining room and dad, it's like there's a different understanding of where children are. And it's for that reason, I think it's just charged us to be just much more different in how we show up when it comes to schooling.
Thank you. Anyone else? Okay. So we're at 6:55, and so we have about 5 more minutes. What I was hoping that we could do to close out is, and I like this idea of gratitude and seeing the silver lining. And so if each of you could just give us, one sentence, what in the midst of the pandemic and the work that you've done, one thing that you are grateful for and about. So I will start with you, Lorien.
Well, thank you. I was thinking, as hard as I worked during the pandemic to support the domestic violence programs, to keep their doors open and to figure out how they were going to pivot to provide the services that they'd been providing, I was very grateful to still be in a position to do that. And I'm also grateful that, and Dr. Moore, you've said it so well, but everyone's really touched on it, this whole notion of it took a pandemic. I think that we've been operating within a sort of gender inequity kind of model around housing, where the person who is victimized has to leave their home, sometimes in the dead of night with their children and whatever belongings that they can grab. And they leave their home, but the person who's perpetrated the crime gets to stay. And so our whole housing model really has to be reworked. And I think that without the pandemic, the policymakers who we need to engage to do that, again, all over the country, not just in New York, without the pandemic, I don't think we would have been able to advocate for that. So I'm grateful for some of the issues that have been put in stark relief because of the pandemic that we might not have been able to leverage before.
Wow, thank you. Dr. Fabray.
My bumper sticker is invest in care infrastructure. Locally, on the state level, on the national level.
Thank you so much. Dean Warner.
Well, thank you. So first, I'm grateful to all of these amazing women for being the standard bearers in their respective spheres to carry these agendas forward. I think I was really struck by Dr. Fabray's comment about the sort of tension between some of the sort of divisiveness of the pandemic and yet a lot of unifying trends. And I am so grateful for any evidence of unification. And I think that, universal policies, universal programs, universal interventions, I think, and sort of acceptance by the public of the need and the necessity for, we all need good health. We all need safe housing. We all need wellness. We all need grace, I think is for someone who's not normally a half full person. I can get up to that. I can get up to the half level when I'm reminded by all of those trends right now toward togetherness instead of divisiveness.
Thank you. And Dr. Maury.
Yeah, together is certainly better. Yeah, I am grateful for, authentic organic disruptions that we didn't necessarily anticipate, but were needed and wanted in some capacities to bring about what our regular work, our regular intentions were not able to do. I've seen people come together in the city here in New York in the most powerful ways that have been transformative, not only for their own hearts and minds, but what it looks like for the 21st century learner. And I'm so clear, I look back on my own youth and, there were times when I was a latchkey kid at home. I didn't know that being a latchkey kid would prepare me to be at home with my own kids in the pandemic. And I'm so clear that our children who have gone through this season, they are being prepared for a greater call. And there's been so much humanity that has come up in communities, and it has gone beyond economics. It's gone beyond what you would think they have, right? And it's demonstrated to me that places where you thought were lacking actually had more to offer than they realized themselves. So in that space, I'm very grateful to be a witness to that.
Thank you so very much. And I am grateful to each of you for authentic discussion tonight. Grace commented, "Oh my goodness, thank you all so very much. This was beautiful. I appreciate your time." And I echo the sentiment. You all, our world is in a better place, our neighborhoods, our communities, because of the work that each of you do. So thank you. Thank you to the Russell Sage community for putting on such a wonderful event tonight. And with that, be healthy, be safe. Have a good evening, everyone.
Everyone.
Thank you.